Dedication, determination, perseverance, good timing, and the right people. It is this rare combination of factors that can make dreams a reality. And it is this rare combination that has brought about the important healthcare contributions made by nurse practitioners. Let's celebrate what we have accomplished and the opportunities that are ahead of us. At a time when America's social fabric was showing signs of revolutionary change, the early 1960s provided fertile ground for the dreams of many. During this period of great social unrest in the United States, politics, race, and gender were at the forefront of what would become historic upheavals by the end of the decade. Other institutions and issues were stirred by the energy of this time, and the healthcare industry was no exception. One of the major concerns of the day focused on providing health services for underserved groups. Simultaneously, many nurses at the time were frustrated with the traditional nursing role. What they wanted was an opportunity to advance nursing through additional education and an expanded role in healthcare. In 1965, Loretta Ford, one of these ambitious nurses who wanted more from the role, joined efforts with Dr. Henry Silver at the University of Colorado at a time when they were both seeking a nursing-based solution for these new healthcare challenges. Together, they created the role of the nurse practitioner.
My role as a nurse educator is not to fulfill medicine's problems, or solve medicine's problems. My role as a nurse practitioner teacher, so to speak, or a professor in a university, is to test the boundaries of the kinds of things that our educational system could do. So I really had never looked at the physician shortage as anything else but an opportunity. Not the reason, but an opportunity to say we need to look at what people need and who can best meet those needs. Now, the social situation, though, at that time was one that the environment was such that it was a very useful one to us. Because first of all, it was chaotic. The tremendous changes at the time, social, political, even legal changes in such a way that the chaos, is opportunity. That's the best time to make change, when there's chaos.
If turmoil creates opportunity, then risk is the currency of tumultuous times, and Loretta Ford and the early pioneers had no aversions to this challenge.
There were some studies done early on in the evolution of the role that looked at a number of factors and looked at traits or personality traits, however you would want to say it, related to the individuals who enjoyed or wanted to go into this role. Risk-taking was one of those variables that would frequently come up.
I think a nurse practitioner needs to be somebody who's willing to take risks. You're really going out on the line at times. You're being willing to put your neck out, make a diagnosis.
They have to be willing to not accept things just because they've been done that way. Because we're really looking at how do we change an illness-oriented system to a wellness-oriented system.
But like other pioneers of this era, their groundbreaking work was done with purpose.
As a public health nurse, of course, I was in schools and clinics and homes and all kinds of services. And we were making clinical decisions already, and I felt that additional knowledge would allow us to make better decisions. The whole profession began to orient itself toward clinical nursing. And when the profession really began to mature, they began to look at what our major goal would be and what our philosophical orientation was. And it was to care for and about people. And in order to do that, you really had to make some very sophisticated clinical decisions.
I would say that the inception of the role in 1965 was actually a great gift to nursing and a great gift to our communities and our global community as well, because I think it was just incredibly visionary and was really a very important role and really has kept nursing at the table through all of the subsequent decades in terms of working with the healthcare delivery system and trying to make it better and trying to design new systems.
While many pioneers contributed to the growth of the role over time, It was clearly Loretta Ford and Henry Silver who led the initial charge.